And we're live.
All right.
Welcome back to another episode of the Let's Talk Show, featuring a very special guest,
A mega superstar. By the way, did you bring your guitar, or are we gonna?
Yeah, I asked
or
that
no,
question
we'll do.
before. It was supposed to be a surprise.
What is it called? Acapella. We'll do acapella.
Thank you, guys.
We have Dr. Eric Ilyayev here, who flew in here from warm Miami, Florida. And he actually thought it's so warm, he doesn't have to have a coat.
Thank you, guys. It's an honor to be on the show, honestly.
We are so happy to have you here, Doc.
Thank you, guys.
And I have actually before we go into it, let's first of all introduce ourselves. So we're gonna start with our showrunner, Miss the one and only Mrs. Yocheved Dekanov.
Thank you so much.
Tell us a little bit, for those who don't know, tell us a little bit about Yocheved.
So I am a physician assistant, public speaker. I also run and host events. So I enjoy that very, very much. I have 4 children, and I do this show. We try to do it together with Avi on a weekly basis.
We try.
And we are so happy that we're having such amazing guests joining us. It is a true honor to be surrounded by these very, very intelligent people where we can learn so much from them.
100%.
Avi, introduce yourself.
I'm a licensed clinical psychotherapist, and I work with couples, with teenagers, with kids, with families, dealing with a variety of challenges that they may be going through. I also work with a bunch of animals as pet therapy in my practice. So those are just one of the tools that I use in my sessions. But tonight, we are so honored to have an incredible human being, Dr. Ilyayev. I think we should give him a big round of applause, right?
Thank you, guys. Thank you so much.
Before we get into what the doctor does, I want to share a little story with you, and we'll talk about this topic and why it's so important to talk about this topic. You know, Doc, and I didn't share this with either of them before, but for those of you who are following Yocheved and saw the comment that I wrote before, that I will be sharing a story with all of you guys that I've never shared with anyone before, at least on a public platform. I did tell, people who are very, very close to me, I did tell them this story. Maybe 4 people, like my parents, my wife, and my siblings. Like, those are the only people I share this with. And now it's time. As I'm speaking, I have chills in my body that I'm going to be talking about it and sharing the story with you.
Well, before we share the story,
Yeah.
Dr. Ilyayev, there's one simple rule on this show. We got to speak very, very
For
loud.
sure. That's right.
So that they can hear us. And if you hear me, let me see the likes, the hearts, so that we know that you can hear us very, very well.
Share this video, guys. This is going to be a powerhouse of an episode. So are you ready for the story? Here it goes.
Not yet. We're going to first let Dr. Ilyayev introduce himself.
Okay.
Let us know what your background is.
Sure.
You're a doctor. What kind of a doctor are you?
Sure. So I'm an internist. And first of all, before that, I want to say what a blessing it is to be here today.
Thank you.
Cheers.
A
Cheers to that.
big applause to the amazing work that Yocheved and Avi have been doing for the community with their show. I always say to Yocheved, I said, Yocheved, you are the Oprah of our community, of the Jewish community.
I agree.
Thank you so much.
So
That means a lot.
it's
Thank
an
you.
honor that you guys have me on the show. honestly.
It's truly our honor that you're here.
Thank you.
When for you to come all the way from Florida, that means a lot. I am so humbled that you would choose to take our invitation and fly down here to be a part of it.
I was very excited. Thank you for having me, guys.
Thank you.
I'll mention a little bit about what I do. I'm a physician for close to a decade. Practiced medicine and did house calls in our community, helping our babushki and dedushki. And actually, Yocheved was a big part of that as well, and she helped the community as well. And I'm blessed to be here today.
We're honored to have you. Really, it's being able to share this platform with you is really an incredible treat. So, are you ready for the story?
Yes.
A couple of years ago, I had a privilege to meet Dr. Ilyayev, and once I met him, we had a very nice conversation. Actually, if you remember, the first time we met in a nursing home. We were both wearing the same exact shirt.
We
were wearing a white shirt with pink pinstripes or something like that. It was the same exact shirt. And since then, everything else is history. We became after a while. So it was a few weeks later. I called you to ask you a simple question, and you said to me, you said, Avi, you know what? Let's go out for dinner and let's talk about this. We went out for dinner, and I was in a time in my life where I was very, I don't want to say the word confused for lack of a better word, but I was like in a place where I'm like, where am I going to go? I was like at a what do you call it, a fork road, wanting to, what should I do this, should I go this way, should I go this way? And for a person who just finished school and is really contemplating on what they should do, I needed to have somebody to be able to just give me some clarity, right? And we went out for dinner. We had an incredible meal. He gave me so much powerful words. And one of the most powerful things you said, Avi, why don't you start making videos? And I said, Doctor, I don't do that. I'm a pretty private person. I don't share anything on social media. I don't post anything. He's like, at this point right now, this is such an important tool that we can communicate with the community, and we can spread the message even further. You should go and make a video. You should make videos. And I said, this is so, one of the things, if you remember, I was struggling with was perfection, right?
Yeah.
It was very difficult for me to put it out there because I said, no, I'm very critical. I want it to be perfect. And it's very hard for me to get out of that comfort zone. And you said, perfection is one of the biggest weaknesses a person can have. When you're constantly striving to be perfect, that's what stops you from achieving so much in your life.
Wow.
And it was it was like 10 o'clock at night. I came home, I filmed the video, and I posted my first video, and I texted Dr. Ilyayev, and I said, I posted it, I think it looks terrible, I think what I said is it doesn't, I felt very, insecure, uncomfortable, but I did it, and you know what, a couple of years down the line, it absolutely changed my life. It brought me so much more connections with people, things that I would never think. And from here we learn the power of words, the power you have to be able to kind of give me that push, give me some clarity, and I'm really forever indebted to you. And to kind of, so I really want to say thank you. And look how this came full circle.
you looking at you that evening, you had it in you. You had the fire. You had the energy. And so it was easy just saying, hey man, just do it, because perfection is the enemy of good.
I forgot to mention the craziest part, which was after our dinner. If you remember what happened, I come up to the waiter and I said, I'm like, hey, here's my card. Let me pay for this dinner. And the guy's like, oh no, it's all being paid for. And I'm like, what are you talking about? I was watching the whole time. Nothing was being, and he paid for the whole meal, and it was like such a humble, down-to-earth person with the biggest heart. And I think talking about this sensitive topic today of dealing with uncertainty, I think we are so honored to have you be able to present this topic for us and what it means to deal with uncertainty. And I know this is your line of work, that you're constantly working with people who are, at end of life.
The honor is all mine, guys. Thank you so much for that wonderful introduction.
Of course. It came from my heart. Really.
Thank you, man.
All right.
So actually, I thought today's topic would be super important because there were some situations that I've personally come across in which family members have somebody who's sick in a hospital and they're unsure of how to proceed. The patient is very, very sick. The doctors are asking questions, and these questions should have been discussed before the family member got into the hospital. But of course, most of us don't plan on being in the hospital anytime soon, and we're not just talking about old people. We're talking about young people too. Mm-hmm. So who better have such knowledge if not Dr. Ilyayev himself? Mm-hmm. So he's here today, and I have a list of questions I want to go over with him in order to enlighten ourselves as a community in understanding how to deal with an unexpected event. Yeah. If I asked everyone who's watching today, what is DNR, DNI? Most people, unless they've dealt with a family member who's sick, unless they're working in healthcare, it's safe to say most people probably have heard of this term, but don't exactly know what the difference is. DNR, DNI.
Yes.
What does all that stand for? So the first question I have for Dr. Ilyayev is, can you please tell us what do those letters stand for?
Right, so DNR and DNI. Before kind of describing, which is great to kind of figure out what that is, I'll tell you why I became passionate about end-of-life care, goals of care, and advanced care planning. I was a resident in the ICU, and the ICU stands for Intensive Care Unit. So things get pretty intense in the intensive care unit. And so there's an 86-year-old patient who is my patient. And the story is the patient had a stroke a while ago, had a PEG tube, which means the little tube that goes inside the stomach, because when you have a stroke, as Yocheved knows and Avi knows, being in the healthcare world, you can't swallow a lot of the times, right? So you need a tube to feed you. He couldn't walk. He couldn't talk, unfortunately. He lost his cognitive ability. And at home, he coded. What does it mean, he coded? So usually the heart goes, lub-dub, lub-dub, lub-dub. But here the heart is like quiet. And it goes,
Flat line.
flat line. Now, the wife is at home. She doesn't really know, oh my God, what do I do? What is the first thing we do?
Panic.
Panic. And then we call
911.
911. So she called 911. 911 came, said, all right, you have any paperwork? Like, what's the plan? Like, any goals of care? What's that? Any advance directive? I don't know. What's that? Any DNR, DN? I don't know. Well, sorry, ma'am. We're going to have to
Resuscitate.
CPR, right? We have to do cardiopulmonary what's cardiopulmonary resuscitation?
Fancy words.
For what? So what do we do?
So it basically means we're going to now revive the lung and the heart, which
Right.
are vital organs for life.
And Yocheved and I actually participated multiple times, both as students and in the medical field in that. So what is that? So you take your fingers, one on top of the other. The patient is laying down, right? The heart's not beating. And you go and you start pumping. As you guys see in the movies, right? 1, 2, 3, right? And then you provide the oxygenation via intubation. So now I'm in the ICU. I see an 86-year-old man. And to paint the picture, he's laying in bed. He is very swollen. Because as you know, in the ICU, you get anasarca, you get edema. And I see the daughter is there and the mom is there. And the patient is laying in front of me. And the daughter says to the mom, Mom, would Dad have ever wanted this?
It's painful to watch.
Did you guys ever talk about, because I see him here, he's suffering, now he has these decubitus ulcers on the bottom of the back and sacrum. Mom, and the mom's like, we've never had that conversation. And I was there.
Wow.
And our doctor never even told us about that.
Wow.
And that is the day that I told myself, listen, when I get out, each and every single patient, it's my duty, it's my obligation to speak to them about goals of care and advanced care planning. So that's kind of where the passion was for this topic.
Wow. That's a huge topic. Is there a specific age where you feel like it's appropriate to start this conversation?
That's a great question. So there isn't really a specific age. It could be just a husband and wife talking together and saying, hey, honey. But again, with the age, you got to be careful.
Right.
Now, we all know our dear babushkas and dedushkas. We love them. But we also know, if I go to my babuля and I say, Babuля Musa, did you ever think about this? Because, there's something where I press on your chest and I put it. She's not going to go to sleep for a week. So there's an art of how you have that conversation. Hey, Babul, you heard there was this relative that we had, poor relative. They were in the hospital and they had this tube inside them. And oh my God. And then you look at her and she's going to be like, I would never want something like that. If something happens to me, you never do that to me. And you're like, oh, wow. Now I know, Granny, where you stand on that issue.
You want to do it while they're alert and oriented and can make their own decisions. That's the best time to have this conversation. Now, Dr. Ilyayev, there's definitely times in which resuscitation and intubation does play a role. So we're not saying that every old person out there who's watching this, let's get them to sign a DNR, DNI form. There's a conversation. We have to know what they want in case something like this happens. Now, let's say the patient ends up in a hospital and they have a pneumonia, that if they get IV antibiotics, most likely they're going to be treated.
Right.
Or they have this kidney insufficiency, they need a little bit of hydration, and they're going to come out of whatever situation they are in. Let's say there are people watching right now that they're kind of like hesitating that if I get my family member to sign that paper, the doctors are not going to fully treat my mother or father. How would you answer that?
That's why I said you're the Oprah of the community by asking these really beautiful questions and pointing out important points. You are 100% correct. It doesn't mean that we're trying to say, guys, sign the paper, don't get no, God forbid. There's two ways, and we all make a decision of what's good for us, and we obviously consult our religious leaders as well, because as we have a physical, we also have a spiritual side, and it's important. But you bring up a great point. Many times, look, doctors are humans. Many times when some doctors may say, and again, not saying anything negative, but there are assumptions where you see a patient that's DNR. You're like, well, there's nothing I could do for them anyway. You know what, it's all right. That's not true. DNR doesn't mean no antibiotics. DNR doesn't mean no treatment. DNR doesn't mean no therapy. It only means do not resuscitate, means compression. DNI only means do not intubate. Everything else you still should do to save a life. That's very important. And you should do everything else. If you want to be resuscitated, you should be resuscitated. But what we're trying to say is you should think about what you want for yourself and your loved one and make the decision with a doctor and with your religious leader.
Happens to be when you get those forms, there are lines there. So let's say the family member says, don't give me any blood transfusion. If I'm anemic, I don't want to have a blood transfusion. You can actually clearly state anything else that you want in that DNI form. The key is to speak about all this at the proper timing. Now, question. Let's say a person didn't speak about it. They end up in the hospital. Who makes these decisions?
So that's a very, very great question. If you end up in the hospital, then look, you've gone to see your PCP, your primary care provider. You trust them. Now think about it. You're in the hospital. You like those doctors, but you don't have a relationship with them. So now if you have cognitive ability to speak and make decisions, you make that decision, but now you're listening to folks who you may not have had care with before. They're still amazing doctors, but you don't have that connection. So it's always best to have it with your own doctor initially. But if you're in the hospital and you don't have the cognitive ability to say the responses, and Avi, maybe you could elaborate on this. Let's think about a son or a daughter who are now in a situation where dad needs to be intubated, but he can't verbalize anything. And now they have to make that decision without knowing what their dad or mom would have wanted.
It's tough.
Yeah.
Like I'm saying, I'm getting chills because how would you react to that?
It's very tough. It's a very, very, because we're literally dealing with life and death.
Right.
And especially even harder than that is when you have, let's say, 5 siblings. And 2 of the siblings want to intubate and do CPR, and the other siblings don't want to do it. And then there's a whole conflict back and forth. And these type of situations where the parents need the most help actually starts to break the whole family apart.
Yes.
And it's such a painful experience to go through. And dealing with in nursing homes and even in hospitals, there's a care plan team to be, and especially there is a social worker on that team as well, to be able to help process through this difficulty. I think today's video is a lot about awareness and just letting you know that if you do have parents, even if for yourself, to be able to go through these documentations, are very, very, very important pieces of documents to have. You know, I can imagine how in your experience, how have you seen religion and culture play a role when it comes to DNR, DNI?
It plays a great role, and that's where we have an opportunity to be partners with our religious leaders and with our rabbanim, right? So I had cases where the patient was in a very tough situation, and the family was very religious. I'm religious too, right? So I get it. And when initially they called the rabbi said, look, you have to do everything to preserve the life, which is important. We know life is sacred. Every second of life is sacred. But then when I called the rabbi, I said, Rabbi, why don't you and I, both go into the hospital. We'll look at the patient together.
Right.
Just get a sense. You and I, not over the phone. And we'll also look at the chart. We'll talk to the specialist, to multiple doctors. And then collectively we can have a discussion. That worked. The rabbi came, the rabbi saw, and he said, look, I've spoken, I've seen, you're right, it's futile, and not only that, but it's also going to bring more harm and pain to the patient to be alive. And we don't want to bring negativity and expedite death if we were to do a couple of things. You're right, let's proceed in a different manner.
So this is a patient who was intubated or not yet, and the decision was what to do?
This patient was not yet intubated because
it's easier that way.
know. Can you elaborate, like, how difficult it is? If once someone is intubated, then what happens?
So once someone is intubated, the problem becomes like this. Now, I'm not a rabbi, I don't play one. From what I've heard, maybe I can be wrong, so if you're a rabbi watching, I apologize if I'm giving misinformation. From what I've heard, if somebody is intubated and they remove the tube,
yes,
and the patient has a chance of dying instantaneously after
allowed.
the tube is removed, we're not allowed to remove the
Correct.
tube. But if the patient has a chance of breathing on their own, and the machine is just being helpful, the patient is not dependent fully on this machine, and the respirator, from what I've heard, again, you have to consult your local rabbi
Agreed.
in your personal cases. You're not really killing the patient when you're removing the tube because the patient is not instantaneously going to pass.
And they have a chance to live, and that's the plan. But you're right. So as we're talking now, it's better to have the conversation about should we intubate or not intubate than not have the conversation. Someone is intubated, and then you're thinking, oh wow, like what do we do now? Because we can't extubate.
Avi brought up a very important point, which is actually it's another concept. Avi was mentioning that when you have a lot of family members, and now who's going to make the decision when the patient is hospitalized? Dr. Ilyayev, can you talk about healthcare proxies and what is a healthcare proxy?
Right. A healthcare proxy is very important. It's a document, it's a real document that has power, that if there's something that happens to you and you're unable to verbalize what you want done for you, you assign a healthcare proxy, I assign Avi, for example, to speak on my behalf, right? So now, many of you watching, you have many children. You have to think strategically, who do I want to make decisions? And you should sit the children and say, guys, I don't mean any disrespect, I love you all, but because I live with Shlomo, and he knows my history and he takes me to doctors, I would feel more comfortable if I love you equally, but at the end, Shlomo has the word. What you're doing as parents now, you're ensuring after you pass that your children are together and not separated in arguments over your passing. Another great question.
Thank you. Now,
It's a difficult process. It's definitely not an easy one to select one of your children. But based on what you're saying, I think it can avoid a lot of unnecessary conversations that are going to go from one sibling to another, which in reality, we really need everyone to be united during this difficult time. So
I had a mentor of mine who was a doctor in the hospital, and he was an attending, and he said, it's better to have difficult conversations than to be in difficult situations.
wow, that's so powerful. Especially going through this process, a lot of the times, especially in our culture, we want to avoid these difficult conversations with the seniors, like you mentioned. It's not what you say; it's how you say it. You want to bring it up in a very delicate way, because a lot of times, like you said, they're not going to sleep at night. They're going to say, why are you all of a sudden starting to think about this? I don't want to talk about my death. I want to live more. I don't want to, so all these conversations can really bring up a lot of fear, but it's because we want them to live a healthy, happy life. We want to be able to create a strategy for everyone to be safe.
and when you ask a patient, especially one that's dealing with a cancer or something, it's almost like, what do you know that you're not telling me? Am I dying already?
Yes.
And it's like, no, this is a universal question. We ask this question from everybody
100%.
because sometimes when you ask patients this, when they come to the hospital, they get scared that, oh my God, my prognosis must be so bad that I'm not even going to come out because look at the questions I'm being asked.
You bring up a great point. What I used to do is, because Medicare wants physicians to have the advanced care planning conversation, I would blame it on them. I would say, "Tzot Marus, you're fine, everything's amazing. Medicare wants me to have this conversation with you, and then I would start. And if I would see her face start to change, I would stop and say, look, we don't have to talk about it now. Just, I'll come back next week. Let's discuss it.
Yeah.
Because this is very delicate. Other thing I'll add, because I think it's super important. Make pretend, guys, I'm your doctor. I had this conversation. We sign the paper. I give the paper. Beautiful. You take the paper. You're the daughter. Mom's in another house. Take the paper. You go home with it. 3 o'clock in the morning, God forbid, mom's not doing one. 911 comes. Where's the paper? I don't have it. Who has it? I don't know. Sorry, if you don't give us the paper, we can't believe that there's a paper. We have to go in. Now, it's okay to go in if mom would have wanted that. But what if mom didn't want that? So I recommend having the paper either somewhere visible or somewhere where people know where it is.
Yeah, a lot of the times, even these types of things, people try to keep very private. Any type of medical situation, a lot of times parents don't want to worry their children, and therefore they will avoid talking about it. They won't share what they talked about with the doctor. But being able to start getting comfortable with that conversation, what do they say? Become uncomfortable. Start getting comfortable with uncomfortable, right? Because that way, we're talking about safety, and we're talking about people's life.
I remember when I was at these meetings, when I worked in the hospital on the floors, we used to have like these palliative care meetings. Palliative basically means it's end of life. The patient is predicted not to have such a long lifespan. And there was a lot of guilt involved.
Yeah.
And we kept telling the family members, it's not about how guilty you are, it's what's ethically proper. What's ethically right for your mother's, father's, sister's, brother's situation.
Yeah.
You know the prognosis because the patient has been here for a couple of weeks already. The blood work is showing, everything is showing. Do you want to keep transfusing blood work? Do you want to keep poking and pricking? And there was a lot of guilt involved.
Yeah.
From a therapy perspective, if somebody is watching, because we never know who's watching, there may be somebody actually that's hearing this and it's exactly what they're going through, and their family members are feeling guilty to make this decision. What would you say to that?
That's a great question. I think this is also part of the grief process. And if you're not dealing with this specific case in your life, you can understand what grief is, because we all go through different types of grief. Right. Even if somebody has a miscarriage, right, loses their baby, that they're also going through grief. Even something as simple as even losing your job or losing your house or losing something very valuable to you, a person goes through a stage of grief. Now, when we're talking about something so serious like losing a loved one, we have to really look at, like you said, that bargaining stage. What does that mean, bargaining, right? There's 5 stages of grief. The first one, when we find out that, think about our life. Everything seems to be fine. Everything is great. All of a sudden, your loved one or even you go to the doctor and you get some negative results.
Or a diagnosis.
That's a huge one. Where a person, the first one, you're in denial. You don't believe it. How is this happening to me? I don't understand. This is not happening to me right now, right? Your world completely crashes, especially if it's happening to your loved one, to your parent. It's very difficult to accept. And once you start to accept that, you become very angry. Why me? Why do I deserve this, right? My parent did such good things. Why is this happening to them? There's a lot of anger involved. And anger, it can be anger towards a doctor. It can be anger towards a person's health history, right? In terms of what do we miss? For example, the third stage would be bargaining. If we would have done this, it wouldn't have been this way. If we would have went to the different doctor, my parent wouldn't be dealing with this. Should have, could have, would have, but didn't. And it's a vicious cycle that keeps on going. And after bargaining, what happens? Telling God, oh God, if I would have done better, God wouldn't have done this to me. And this whole cycle back and forth, which is completely exhausting, a person becomes very depressed and exhausted and sad and is running on low fuel, not having any hope for their life or for their loved one. After depression, of course, that whole entire cycle, eventually with the proper care, with the proper team, with the proper conversations and being patient through this period, because a lot of times when a person is involved in this kind of state, they want to fix everything. You have a problem, especially if you're a child and you have a parent who's not well. You want to fix everything, and you get so angry, especially with your medical team. Where you'll get angry with your doctor, you'll get angry with your nurses, with your social workers, with your whole team. I do want to mention, however, this is a big piece. You are the number one advocate for yourself. There will be nobody who will advocate more than yourself. Even if it comes to a doctor, if it comes to a therapist, if it comes to a psychiatrist, to anybody, talk your feelings out. A lot of the times people feel very afraid, and Yocheved, I think you were talking about this, very afraid when all these documents start coming out and all these fancy words start coming out. You feel like, I don't want to sound stupid. I don't want to say something that they may think I'm stupid or not understand something, and you just stay quiet. And you go into your car and you drive home and you're so afraid and in panic. The main key point is, if you're not sure, ask again and ask again. Definitely being able to get your point across is really important.
And very often, kind of to piggyback on that, when people go through grief, and they go see their doctor, and they may not verbalize things correctly. Folks may think, oh, they're just depressed, and they give them medications. Yeah. But it's important, as you said, to talk it out, to seek help from professionals, have these sessions where instead of just medications, you're able to fix things by speaking to one another or to a professional.
I remember having a conversation with someone who was depressed. And I said to them, and they were on a very heavy medication. I said, how did you start this, this medication? What was the process like? Right. She said, I went to the psychiatrist. I told him how I'm feeling well. We spoke for 10 minutes, maximum 10 minutes. I got this prescription and I left. And I've been on this medication for 3 months and I can function well. I'm very sad. My life still feels like it's stuck. This is a person who went through grief. This is a person who lost someone. That grief is still stuck inside of them. It needs to be talked about. It needs to be processed. If you're going through a lot of fear and have many questions, talking about this can definitely help. I do want to mention, Doctor, as you were sharing from your experience and your sensitivity, unfortunately, sometimes we don't always find doctors like that who will be so gentle and just watch, the color of your face turn and stop the conversation because they don't want to push you, further than you need to be. So that's why it's so important also to be comfortable with your provider and be able to share what's really bothering you. What are your thoughts, Doctor?
I'll tell you why I started to practice in this way. So I'm a resident, first year, and we just had a kid, a third kid, and Brit Milah, everything's great. My wife calls me and she says, Eric, something's wrong with Yosef. I don't know what's going on. I come, I'm like, he's yelling, he's screaming nonstop. Get him undressed. I'm looking, he has a huge hernia. Huge. The kid's like maybe 2-3 weeks old, right?
Luckily you were a doctor. I would have lost it.
well, listen, I take him in my car. I drive like insane. I get to LIJ probably in 3 minutes.
Oh, wow.
3 minutes.
Oh my gosh.
Red light, no, I was like, a father. I come there's a resident there, surgical resident. Now I'm an internal medicine guy. Internal medicine, he's a surgical resident. He looks, so he's like to me, don't worry about it. Because it's 3 o'clock in the morning now. Doesn't want to who wants to do surgery, right? It's like, oh, it's reducible. Now, I knew, are you sure it's reducible? He's like, it's reducible. Lo and behold, it wasn't reducible. It got infected. It should have had surgery that second. Dr. Kessler, Edmund Kessler, amazing doctor from South Africa, great guy. He came in and was like, what's going on? So Yossi got an infection, needed antibiotics, needed urgent. Why? Because that resident didn't stop and say, what if this was my son? What if this was my mother? What if this is my grandmother? So some of the folks who are watching, if you're going into healthcare, like we're in, remember that could be your mom. And it will be your mom. One day, someone else will be treating her. So act with love and respect.
I think you're getting so much love. Look at that. Everyone is agreeing with what you're saying, Doc. Thanks for all the comments and love.
By the way, we're going to be ending shortly. So if you still have questions for Dr. Ilyayev while we're live, please share your questions so I can ask him and we can get it answered. it's interesting you brought up that story. I think I've said my story before,
I'd
but
love to
it's
hear it.
worth repeating it again. And this is by no means whatsoever to belittle, diminish any medical provider's knowledge, because
Right.
we are medical providers.
Agreed.
It would almost be like we're talking against ourselves. This is simply to bring awareness. When I asked the question about guilt, I think one of the ways to prevent guilt, and I'm going to share my story in a minute, is to be familiar with the medical diagnosis. Now, that doesn't mean go to Google and just type in a symptom and think that Google is going to be your doctor. You have to go to legitimate sources. You also have to familiarize yourself with the medical diagnosis so that you know that there are some things that are curable and treatable, some things are common, some things are not common. And when you're familiar, you've done everything in your power, you will know that you did whatever it took on your end. Now, I'm going to share a story. The story went as follows, and again, it's similar to your story in the sense of a young child being involved. However, my story did not have a very good ending, which is why I decided also to go into healthcare, and why I find it to be so crucial for the medical staff to have empathy, to really put themselves in the position of, what if you are the person sitting there waiting for the results? What if you're that person who's not really clear? What if you're that person dealing with that family member who's really critical? I think it's very important for healthcare providers who are watching to really, as tired as you are, as busy as your life is, you really do have that obligation. Now, my niece, when she was 3 years old, it was on the birthday, she was going to be 3 that day in the morning, she had a seizure because she had a very high fever. Now, febrile seizures are very, very common because when the temperature rises to a certain degree, the body sometimes will lead for the seizure. So it's a very, very common thing to happen. My sister, of course, freaks out. The baby drops from the couch to the floor. She becomes a little blue. She takes her to the hospital. I'm not even going to name the hospital because that's not even going to be important. People think hospital makes a difference. By the way, always pray for the right doctor on the shift.
Yeah.
The hospital is not the
Right.
main thing here. It's the doctor
100%.
on the shift.
Good point.
So when they take my niece to the hospital, they bring down her temperature. She's fine, but she's very, very weak. And of course, it was also in the middle of the night. The emergency room tells my sister at that point, you know, it's very, very common. There's nothing wrong. You could take her home. When she took her home, there was no workup, no blood work, no nothing. It wasn't even like, why is she having this fever? Where is it even coming from? Simple blood work. Simple, just like, let's make sure we eliminate any possibility. I always have this mentality.
Right.
Let's eliminate the worst.
Beautiful.
When we eliminate the worst, everything else is okay. So when you do like simple blood work to just make sure the white count is not elevated, like there's no real source of infection or sepsis, like what's going on here? They send her home. My mother calls me up. She tells me, don't worry. Leah came home. She's fine. Leah went to sleep that night and told my mom, it was her birthday in the morning, I want a new set of pajamas. My mom was so excited. She said, I'll buy it for you. Unfortunately, that same morning, my sister goes to Leah's bed and Leah did not wake up. Leah was gone. And I remember I was still in PA school, and I remember there were 2 tests that I failed, because you remember this stuff. That was one of the tests because I had to go on my rotation and I had to go to the funeral.
How old was Leah?
3 years old. It was her 3rd birthday. And it was just one of those moments in my life where I wanted to be in healthcare after that more than ever before. Not because I'm God and I'm going to all of a sudden eliminate. When we're meant to go, we're meant to go. I mean, there was going to be 101 excuses because our time in this world is over. But the point would be a little bit of closure. Had I known, or my sister had known, that somebody took that extra step to do the blood work or to give that extra eye, to just do a little bit of a workup. Let's do a CAT scan of the head. Why did she pass out? Why did she turn blue? What exactly could have happened? When you take that extra step and you work up a patient, when the patient goes home and something happens, there's closure. We did everything we were supposed to do. You won't say, but maybe I didn't take her to the right hospital. Maybe I didn't do this, or maybe I didn't do that. So my point to those who are watching, although we don't like when people ask us too many questions, like I'm talking about from healthcare,
Right.
doctors and medical staff don't like too many questions. Sometimes you need to be the advocate for yourselves.
Yes.
Ask the questions.
I wanted to comment on what you just said.
Very powerful story.
Yeah, that was very, very powerful. You know, based on what you're saying is sometimes medical professionals don't like the questions, and I hear this a lot from my clients. If they're unhappy with their medication and they want to decrease their medication, or they question their psychiatrist, why are you giving me this medication? Maybe we can start talking about weaning me off from the medication. They feel like they're getting eye rolls, or they're being dismissed, right? So people can say, I don't want to talk about it with them because every time I ask, I feel so stupid. They're pushing me up, so I just don't ask and I just continue taking it. Or I don't want to tell them how I feel if it's not making me feel good. And these different types of symptoms. If you're hearing this message and if there's one thing that you can take away, this is so important to realize, is like Yocheved and Doctor said, you are the number one advocates for your care. And those eye rolls, all those nonverbal ways of communication that they communicate with you, making you feel like you're a bother, call them out on it. You can say, hey, I noticed when I asked this question,
Right.
I noticed you didn't answer me, or I noticed you rolled your eyes. What was that about? You know, a lot of the times we don't communicate the things we see, but our facial expression has a very strong way of communicating. So when you kind of talk about the elephant in the room, right? When you bring that up to their attention, they're going to start getting to the awareness of like, whoa, and get back centered. Because Doc, like you said, doctors are humans too. Anybody, this is not a place to, you know, put medical professionals in the corner.
They're
You
heroes.
know, they really are. They really, especially what happened with the pandemic and all of that.
Right.
You know, I've seen personally nurses and PAs and doctors and CNAs and LPNs and all these different healthcare workers really on the front lines, exhausted, so tired. And you know what? Just like you said, we're humans too. You know, and we sometimes, you know, doctors and therapists and PAs and anybody in the medical field, you know, mistakes happen. It's very, very unfortunate, but that's why it's so important for you to also have that communication, so we make sure we get you the best care possible.
Greatly said. And before we end off, another very important question for Doctor. What is hospice, and how can we make a decision when somebody should be placed on hospice?
You know, that's a very, very good question. A lot of the times, you know, there's someone by the name of Charlie Munger. Charlie Munger is the business partner of Warren Buffett. And he has an interesting rule. He says, when you want to figure something out, use the rule of inversion to say what something is not. Like, remember when you take multiple choice questions, you have A, B, C, D?
Right.
You first say, well, it's not this, it's not that, it's not that, it's that. Or, like, if you want to be something in your life, you're going to say, well, I can't sing, so I'm not going to be a singer. Can't dance. So you knock everything off, and then, so I think we should start with what hospice is not.
Okay, great.
Right? So hospice is not, God forbid, oh my God, well, I'm putting my mom on hospice. That means we're giving up, we're doing nothing, we're just going to give her morphine, and we'll call it a day. That is not hospice, by far. Because the reason I say that is because a lot of our community, we feel like that is, we think that is. It's a misconception, it's a myth. So what is hospice? Beautiful question. Hospice is when you have someone who has a terminal illness. Say you have someone with Alzheimer's disease, right? Very late stage Alzheimer's disease, or a cancer. Or you have somebody with congestive heart failure where the heart is not pumping at all. And now that person says to the daughter, Sarah, yo, Stala, I'm tired. I don't want to go to the hospital anymore. I'm tired of nurses pricking me with blood. I don't want that. I want to live. I want to survive. If I have an infection, I want you to treat me. If I need medications, I want you to give it to me. But I just want to be left and be in comfort.
Comfort.
Comfort. I actually don't like the word hospice. I would love to rename it comfy care. Comfy care, right? It's comfortable care.
Trademark that. I love it.
That would be great. So
Comfy
that's,
care.
and with hospice, it's super important for our community to understand that, yes, hospices are different. I worked with, for many years, Natalia. I love Natalia in Rakova. I worked with her, and she's also Baharian, and it's important from a culture perspective, because I could call and say, look, we have to talk to this hospice, and then I used VNS. There's many. You can use whatever you feel. It doesn't matter. But you could say, look guys, we have a culture, we have a religion, we act differently. Can you please tailor hospice according to us? What does it mean according to us? Well, number one, before you push the medications of anything for pain, I want you to call my doctor. I want you to call my rabbi. I want you to ask me for permission. And that's how I was successful in getting patients in hospice, because the control was not in my hands. Yeah. The control was not in the hospice's hands. The control was in the hands of the patient and the family, but they got the resources that they need, because I, as a PCP, don't have 24/7. I can't come at 2 o'clock at night. Hospice can. I can't send a nurse at 4 o'clock in the morning. I'm a PCP. Hospice can.
Oxygen.
Special
hospital.
I mean, you know this better than anybody, Yocheved. But it's important to get, again, the rabbis involved and to communicate. Just like what you said about DNR. You should tell the hospice guys, just because I put my mom in hospice, I want you to understand, I want a lot of things to, and we could do IV antibiotics, hydration in hospice.
Yeah. Somebody said, is palliative same as hospice care?
No. Palliative is a different approach, and it's pre-hospice. It's not yet approved by Medicare. There's no yet like official palliative programs, but they're coming. Great question.
About guilt, we were talking about, a lot of the times family members struggle a lot dealing with guilt because culturally they grew up in a home where they heard, when I grow old, you better not put me in a nursing home, you better not put me in any of these type of centers. But it's also, and I work with families who have a very difficult time talking with their relatives, because they're looked at in a way where, how could you put your mom into a nursing home? Because, like you said, they're exhausted. It can be very, very tiring for a family member, especially for somebody that cannot lift, they cannot shower, they cannot eat. So being able to have that 24-hour care can be very helpful.
What about home hospice, somebody says?
Yeah, so most people now actually get home hospice, which is, and someone mentioned about the kids. They're right. If you have kids, young kids at home, it is a difficult process. But if not, they're in the comfort. I always say, look, if you don't want to go to the house, where do you want your last moments of life? How beautiful is it if you have your children, your grandchildren surrounding you, right? And you're giving them that blessing, as opposed to having ding, ding, there's a hospital, there's a nurse at 3 o'clock taking your blood, and the result will be the same.
Right.
But, how do you feel when your last moments of life?
Yeah, this was so powerful. This was definitely
thank you guys.
Not easy to talk about. These topics they're pretty heavy. But if we look at life, and a lot of times people try to avoid these conversations, but it is a part of life, and we hope to live a long, healthy, happy life. But it's very important to talk about these conversations. And as you know, our tradition on this show is to end it off with a game. So today we're actually going to play 2 games.
Before the game, I want to see the likes and the hearts. If you thought this show was important and helpful, let me see the likes and the hearts and the smiling faces.
Give Doctor the likes.
Eric
Look at that. They're all coming in.
Thank these guys.
They're all coming in. So tonight we're going to actually play a very interesting game. A lot of the times when we were talking about fixing, people want to fix stuff fix situations whenever it gets difficult, and a lot of the times we need to stay present in the moment. Talk to them about their life, and talk to them about their youth and what they did, and being able to communicate and connect is very powerful. So there's a game, it's called the Ungame, and we talked about this in the past. There's different versions. This one is the senior version. If you go on Amazon, you can just type in the Ungame. There's one for families, for couples, for teens, for children. This one is the senior version, because sometimes you might say, what do I talk to? What do I talk about with my grandparent? Right. What do I talk to?
Babula, you want to play the Ungame?
Exactly.
How
do we bring these conversations? And I can't really relate to them, right? We're in different age groups, right?
That. Let's play a game.
This is exactly, and then we play a game and we ask questions. So Doc, are you ready? I know you're not a senior yet, but we're gonna ask you a couple of questions. All right?
Good.
So here we go. We don't know what the questions are. We're gonna mix it up. All right, here we go. I love this. Are you ready?
Okay.
Doc, so appropriate for doctor. Have you been a good money manager in your life?
Oh,
Talk
that's
about
a great question.
You know what? I think that I've learned if you serve people and you do it the right way, you give your heart and your soul, then from a financial perspective, you'll be okay.
Wow.
Life is about service to others, and then you'll be a great financial manager.
Dude, that's
Look at
what
this. Somebody gave us titles. Our very own Oprah, Dr. Oz, and Dr. Phil.
I love that. That is
I love that.
That is
I love
awesome.
that.
Wow.
Who commented?
Alana.
A lot of shout out to you. But I think so. Based on your answer, the way you asked this question, and it can seem like a very on the surface type of question, but if you look deeper, finances is a very big conversation
Yes.
you have with seniors, with parents, right? A lot of the times one of their concerns are, who am I going to leave the money to? How am I going to split it up? Do I have enough money for my funeral? Do I have enough money to pay? So all these are conversations. These are conversation starters. So even though you responded with your answer, you can even take it a step further and ask, hey, let's talk about your finances. What's going on there? And this way it's going to allow them to talk about what's really going on. Yocheved, are you ready?
Okay, let's see.
All right, here we go. Let's mix it up. All right. Yocheved. Wow. This is a deep question. Are you ready?
You're getting it like that's a great intro.
What can one do to prepare for his or her own death?
Wow, that is a deep question.
Live your life every day like it's your last one.
Wow.
Because if you live your life every day like it's your last one, and that's something I'm still working on, you're going to not allow things that aren't that important to penetrate you, to make you take away the joy from yourself. You're going to make sure when your kids go to sleep that you're going to make time for that hug and kiss and bedtime story. You're going to resolve issues that where you seem like, you know what, I'm not going to make up with my friend. She has to apologize first. I'm going to let her, think about it. But meanwhile, you don't really know how much time you have on this earth. And many times we eulogize people after they go away. We say how great they are and how much they meant to us. But we forget to do it when people are still alive. So when we start to live every single day like it can be our last one, we're going to really be the best. We're going to try to be the best versions of ourselves.
Can I add something to that?
Of course.
So powerful.
Wow.
I heard something exactly like what you're saying. I have a neighbor in Florida. His name is Mayor. Amazing guy, older guy. Sometimes mentors me with wise words. And he told me, Eric, if I had a fight with my wife or my kids or my mom or dad, that day, I never go to sleep without mending the situation.
Wow.
I said, why? He said, because I don't know if I'm going to wake up the next morning.
Wow, love
Or
that.
someone else will wake up. I don't know that, so I never go to. I'm like, wow, that's a lesson to me.
That really takes a lot of inner
That's
work
part of what you said,
to
which
be
is
able to do that.
I try my best to live by that motto. I try, especially with my spouse.
Right.
It's hard to do it with other people sometimes,
Right.
but with the spouse,
Family,
family, children, our husband, wife. I think that's parents. That's super, super, super important. As hard as it can be, some people think people who are apologizing or try to make things out, they're weak. I actually think it's the other way around.
Yeah, right.
Those that try to mend the situation and and come and say, you know what, let's just make up for it. They're the ones who are really strong.
It takes a lot of strength to be vulnerable. Absolutely, I agree with that. Go ahead.
All right, now I'm excited. Okay,
All right, let's see.
talk about your grandparents.
Ooh, that's actually on my drive here. I'm at this point. I'm still. Thank God, I'm fortunate enough to have both my parents alive. And I was thinking about grief and losing someone, and the first people that came to my mind were both my grandparents. I lost them a year apart when I was really young, 9 years old, and actually I was playing one of these games with my wife this past Shabbos, and one of the questions were, if you can talk to somebody, living or dead, from who would it be? And I actually said my grandmother, because it's different than your parents. It's like they have like that soft spot for you.
Absolutely.
So it definitely hurt, and I was still young, but my parents were there to help me through that grief process. And losing someone is definitely not an easy process, and everyone grieves differently. Today, to kind of segue, we're going to play one last game, and we played this in the past, but this ball is everything to do with stress. And I know how we talked about some topics that can bring up some stress for people. So this is another icebreaker. Doc, are you ready?
Yes.
This is how we play. I throw the ball to you. You catch the ball. Wherever your thumb...
This is live, so throw it lightly so I catch it.
Alright, you'll catch it. You'll catch it. Wherever your thumb lands on, that's the question you read. Are you ready?
Yes.
All right, here we go. Good catch.
Thank you. Which urgent tasks most distract you from important ones?
Oh, I like
That's a
that
hard one.
question.
Yeah.
Can I pass the ball? Is that allowed in the rules?
Next one. Or you can throw it up and catch it.
Which urgent tasks most distract you from important ones? Yeah, I think work and the day-to-day bustle and hustle of life. And then you look at night sometimes and your kiddos are sleeping and you're like, man, I wasn't home for 3-4 hours. They went to bed and I didn't get to kiss them goodnight or tuck them in. That's a day lost. Was this urgent task that I had to go to this meeting really more important than my kid?
A reflection, like you reflect on the day.
You answered it beautifully.
Thank you. I had to read it twice to think of the answer.
That was a beautiful answer. Okay.
Thanks. 1, 2, 3.
Who do you hope will cut you some slack?
Can you say it online?
I don't know. I don't know how to answer this question.
How about this? Tomorrow your kids are having cereal and sandwiches for dinner.
Like my responsibilities. My husband. Maybe we'd switch roles for a week.
For a week? Wow.
Okay, ready, Abby?
Yeah, I'm ready. Here we go. All right. When I'm stressed, that's a good one.
That's good for you.
So personally, my personality, take off my therapist hat for a moment. When I get stressed out, I actually get really, really quiet. And I kind of get in my own head, and I'm not the best communicator. And I think, I kind of hold it in a lot. I process a lot. And through becoming a therapist, I've learned that the more I hold it in, I'm hurting myself the most. So being able to kind of talk about it, even though sometimes it's hard for me, it's interesting, it's ironic, right? I'm usually on the other side. I started to have that channel of communication to say, let me talk about it. But also what helps me is my pets, nature. I love that type of stuff. But this was so much fun. Doc, again, thank you so
guys.
much.
I'm so
thank
honored
you
to be
so
here today,
much.
guys.
I know
thank you so much, guys.
You're far away from us. You're all the way in Florida. But if we're ever out there, we have to meet up. And guys, if you're in Florida, go check him out. Wait, follow him on LinkedIn and social media. You guys should know, not only is he a super professional doctor, but he's an incredible musical artist as well. What kind of instruments do you play?
Piano and a lot of vocal. I love
vocal.
Yeah.
You sing with your family also?
I do. My kiddos.
Your kids.
It's a special thing.
Wow.
He used to do videos for Facebook, and I was actually telling him before we
do it
went
again.
live. I said, "Can you start doing that
Could
again?"
you
I really enjoyed them.
Thank you.
That's
Thank you.
amazing.
But it was really an honor and a privilege to be here on the Let's Talk show.
Thank you so much. Thank you.
Good
guys.
night, everybody.
Until
Thank you
next
so
time,
much
have a
for
good night.
tuning in. Wow, what
Bye-bye.
a show! I wish we can do a musical jam, right? Play on.
All right, buddy.
on
Thank you again, guys.